Let me just clean off my glasses real quick. So I can actually see, bro, what is it like to have 20/20 vision, really? What is it like? Does it feel like this and you just don't have the hassle of glasses and contacts? Can't fathom it. Can't fathom it. Okay. Okay. Y'all, look at my shirt. Okay, do you see it? Everything is fine. Everything is fine. This is literally, I feel like, a perfect representation of today's topic because people around you and doctors may say everything's fine, but it's actually not fine. It's actually not okay. It is actually so far from being okay. It is criminal. It is literally criminal. And anybody who is in the room when you're giving birth, and if this happens to you and they're like, it's fine, it's okay. No, it's not okay. It's not okay. So, with that being said, welcome back to another episode of Doula Tea Talks, where I spill all the tea on pregnancy, birth, postpartum, and everything in between. My name is Maya, and I am a certified birth and postpartum doula, and I pride myself in telling you the truth and keeping all the bullshit off the table, okay? I am very honest, and you will always get the truth from me and nothing but the truth. So, let's get right into it. Today, we are talking about something that has previously been routinely done, but studies have shown and outcomes for moms have shown that this is not beneficial and it is actually damaging to moms and sometimes even damaging to babies. What is the topic, you may ask? Today we are talking about episiotomies. Ever heard of it? In today's video, I will be talking about what it is, why it has been routinely done, and why we want to avoid it. And make sure you stick around until the end, where I will be sharing what you can do during pregnancy and birth to lower your risk of tearing altogether. Okay, so first things first, what is an episiotomy? What is this weird word that we are talking about? So, to put it in simple terms, an episiotomy is a cut made along the perineum. If you don't know what the perineum is, that is the space between the vaginal opening and the anus. So, I mean, right off the bat, you can get a mental picture, right? It is a doctor taking a scalpel and cutting you right along the area in between your vagina and butthole. It sounds just as gruesome and painful and unenjoyable as it is. If you ever see your doctor picking up a scalpel or scissors, okay, ask them why. And this is why it's so important to have a birth doula, because having a birth doula ensures that you have somebody who is not you, right? Because when you're giving birth, you really need to be in your body and you really need to be in the experience. If you're looking outside of yourself and trying to make sure that the room is safe, birth is going to be disrupted. So, as a birth doula, this is something I always ensure. And luckily now it's not so much of a routine thing. Previously, it has been a routine thing. Back in the 1900s, it became routine because doctors believed that it helped with childbirth. It created more space for babies to be born. But the studies have shown, and the outcomes for mothers and babies have shown, that it is better for you to naturally tear than it is to get a surgical cut. And there's many reasons for this. When you have a surgical cut, it increases the likelihood of tearing even more. When you allow the body to naturally tear, it tears as much as it needs to. But when we just automatically put in a tear, like a surgical tear, it is going to rip it even quicker and faster. And let me see. Let me think of an example. So, hold on. Let me get a piece of paper. Let me actually show you guys. Okay. Don't come for me, guys. I was kind of ill prepared. I didn't really think I was going to use an example, but now that I'm here filming the video, I'm like, bro, I could easily get a piece of paper and show you what I mean. So, okay. So don't mind my crinkled up paper. So essentially, the body knows how to stretch, right? Your body was literally designed to birth children. That's what the female body is designed to do, right? So, first and foremost, lean into nature. Lean into the fact that your body was literally built to do this very thing, okay? Trust your body. Trust that it's going to stretch, and trust that if it needs more space, it will naturally tear the skin as needed. So, using this piece of paper as an example, right? There's no tear. Let's imagine this is your perineum. There's no tear here, okay? We're pulling it. I'm pulling it with all my might. Literally, I can't pull this any stronger. It's not tearing. It's not tearing. If I was a little stronger, I would be able to tear it, okay? If your body really needed to tear, it would tear, okay? But naturally speaking, most women don't tear during birth because our bodies know how to stretch, okay? Or let me be more specific, more women who are giving birth 100% unmedicated are more likely to not tear, okay? Because when you're unmedicated, we're trusting the body, we're trusting the process, and your body is taking its time to naturally stretch as it goes along. Now, when you have the epidural, and I'm not hating on the epidural by any means, but let me explain how this plays a role here. When you have the epidural, you can't feel what's going on down there. So a lot of the time in the hospital setting with an epidural, the doctor or nurses or midwife is going to coach you through pushing. Coach pushing is less ideal for the body because the body has an innate knowledge as to when to push and how to stretch. So when we take away your feeling and when we take away the body's natural ability to push and stretch on its own time, we increase the risk of tearing because we're forcing something that might not be ready. So, yeah, there's just some knowledge for you guys there. Okay, now, imagine we're doing an episiotomy, okay? Like I said, I'm ill-prepared. I don't have scissors, but I'm going to make a little tear here, okay? So, this is your perineum. Your doctor just cut you. Your doctor just gave you an episiotomy. Now, you are stretching. It's going to make it so much worse because that tear was already there, okay? So notice how the first time I pulled with all my might and there was no tearing. This time there was already a little tear started, and just by pulling, it split right open. This is why we do not want an episiotomy, okay? Because it will make tearing so much worse. You will tear so much more than you need to, okay? Now, if you saw the example, right? If we didn't do the episiotomy, there was no tear happening. There might have been a little tear down the road, but there was nothing happening at that point. But because I did the little episiotomy, it tore the paper in half. It's the same idea when it comes to your perineum. I don't want this to happen to you, babe. Okay, so this is why we're talking about episiotomies and why we want to avoid them at all costs. And to be quite frank, that absolutely has happened to people. Not my clients personally, but I know that that has happened to people who have had episiotomies and split all the way through the perineum, all the way to the butthole. Oh my gosh, please. We don't want that happening, like seriously, because that comes with its own cascade of issues and interventions that comes after the fact. Let's avoid episiotomies in the first place. So a great way to get ahead of this issue is to bring this up with your doctor or midwife during your prenatal appointments, okay? Don't wait until you're in labor to start asking these questions because you're already too late, okay? Get to know your doctor and what they call routine procedures, okay? Some doctors are going to be like, oh yeah, like I always give episiotomies. Run, okay? Run. I don't care if you are 34, 35, 36 weeks pregnant and you discover that your doctor moves this way. Run. And I can't say it loud enough. Run. It is not too late to switch care providers. It is not too late, okay? The only time it is too late to switch care providers is when you are actively in labor. By that point, okay, we might be a little behind. But during your pregnancy, it is not too late. So please, if your doctor says, oh yeah, I always give my clients episiotomies, or oh, half of my clients receive episiotomies, or yeah, we do them because da-da-da-da-da, no. Da-da, no. Run, babe. Run. Look for a new I am tripping over my words because I'm so passionate about this. Look for a new care provider with a quickness. Okay? With a quickness. There's no, oh, they do episiotomies, but I'm sure it's going to be fine. No. 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 And that's my tangent on that, okay? What we want to hear your doctor say is, no, I do not do episiotomies. We don't even want to hear them say, yeah, sometimes I do. No. The only time where an episiotomy is really needed is if your baby is genuinely, wholeheartedly stuck. Like, wholeheartedly stuck. And this, if we are following the body's natural way of birthing, it is extremely unlikely that this would happen, okay? A lot of the time, we see babies stuck when moms are laying on their backs, okay? So if you are in labor and you are pushing on your back, babes, again, why it's so important to have a doula, please, guys, do not push on your backs, okay? Don't do it. Don't do it. Because first of all, we don't have gravity's help, okay? Let's imagine, right? Let me get all nice and personal here. So I am birthing a baby and I'm laying on my back. Gravity can't help because I'm having to pull this baby out and up, okay? When you could also do something like this, right? If you're in a birthing position like this, gravity has the opportunity to help your baby come out. We are working with gravity. And I will do a video all about birthing positions, but just to give you that example, we want gravity to help. So if you are in a birthing position that utilizes gravity, it is extremely unlikely that your baby is going to be stuck, and it is even more unlikely that you will need an episiotomy. Seriously, babe, if your doctor or midwife talks about episiotomies like they're just some casual routine thing, run, okay? Even big organizations such as the World Health Organization and ACOG no longer recommend episiotomies, and they say in their guidelines that they're only needed in extremely rare cases, okay? So if you're with a care provider who is not staying up to date with these studies and guidelines, that is a red flag, okay? It is a burgundy red flag. It's not like, oh, it's a yellow flag. Like, it's okay, it's fine. No, it is a red flag because what else are they not staying up to date with? Okay, if this is one thing that we're noticing that they're not up to date with, what else are they not following guidelines for? And that is why it's a red flag. This is why it is so important to talk to your care provider about their policies and guidelines and the way that they do things long before you go into labor. These conversations are so essential, and many people skip over them because they just don't realize that they need to be having these conversations. Please do not fall into that category. If you stuck around till the end of this video, congratulations. Let's talk about tips for preventing tearing. So, first thing I'm going to tell you guys, a great way to help prevent tearing before you go into labor is doing perineum massages. This is something that we want to start during the 3rd trimester, and I can create a video talking more about this, but if you Google perineum massage during pregnancy, you're going to get the gist of it. Okay, tip number 2, using a warm compress during the pushing phase. So this could look like getting a washcloth or a small rag and wetting it with really warm water and then placing it on the perineum. This is great for during pushing, but this can also be really comforting during laboring as well. And this helps soften the perineum. That way, stretching is just that much more easy. The 3rd tip I have for you guys is positioning. Now, if you have the epidural, we're a little more limited on positioning. This is also why it's great to have a birth doula, because there are positions that we can do with epidurals, even if you have them, but it is a little trickier. Now, if you're going unmedicated, we're going to be wanting to do positions such as the squatting position I showed you earlier, such as going on all fours, doing positions that actually utilizes gravity. Okay, now I will, in the future, create a video all about natural birth positions, so stay tuned for that as well. And lastly, the 4th tip I have for preventing tearing is take your time. If you're going unmedicated, we want to avoid coached pushing. If you have the epidural, it's a little harder to avoid coach pushing just because you're a little more disconnected from your body, and it just makes things a little trickier. But if you're going unmedicated, definitely avoid pushing. Your body will spontaneously start pushing. So wait for that sensation to happen before you just start pushing. That is going to significantly decrease the risk of tearing. Now, if you do have an epidural, it is likely that your doctor will be giving you cervical checks to, figure out where you're at. Always remember that you can deny cervical checks, but that's not the point of what I'm trying to say. Your doctor is going to be doing cervical checks, and before they even allow you to start pushing, they're going to ensure that you're 100% effaced and that you were 10 centimeters along. So that is the green light that we need before pushing. We want to ensure that you're not pushing before you reach that point, because that can increase tearing, and it can also, create other issues in the body that, y'all, there are so many videos that are coming soon. I'm not even going to get into all that, but you get what I'm saying, okay? Okay, so now that you have more knowledge on birth and what we want to avoid and what we want to lean into, I would love to invite you to start thinking about postpartum. A lot of the time, we spend so much time and energy focused on pregnancy and birth, and then after you give birth to your baby, you're like, okay, now what? What do I do with this baby? Okay, if that's you, if you're feeling like you're not prepared for the whole newborn thing, if you're feeling unsure or even anxious about having a baby and having this child rely on you for everything for the rest of their life, it's a little bit of pressure. If you're feeling a little concerned about that, I would love to invite you to check out the newborn education course that I just launched. You can find the link down below in the description box. So if you feel a little lost in the sauce when it comes to taking care of your newborn, this is a course for you. And without further ado, thank you so much for joining me for today's video. If you enjoyed it, please like and subscribe and share this with a mama who deserves to know the truth about episiotomies. Thank you so much for joining me, and I'll see you guys next time. Bye!